Work is now underway on Maine's first psychiatric residential treatment facility for children and youth on Sweetzer's 200-acre campus in Saco. The secure facility will help address a crucial gap in mental health services and allow kids currently in out-of-state treatment facilities to return home.
However, critics are arguing that placing kids in crisis within a locked facility does not resolve the issues related to Maine's broken mental health system. News Center Maine's Vivian Lee has our update.
Crews are clearing out furniture and renovating an existing residential unit on Sweetzer's Saco campus. It will be the site of a psychiatric residential treatment facility, or PRTF, and will have up to 16 beds for children and youth with mental health needs.
And we'll have a secure outdoor area so the kids can go outside and have access to fresh air.
Sweetzer CEO Jane Von Bremer shows us the plans for the 8,000 square foot building, utilizing $2 million in funding from the Maine Department of Health and Human Services. Establishing a secure residential program comes after an agreement with the U.S. Department of Justice, ending a federal lawsuit that alleged Maine unnecessarily segregated children with behavioral health problems and disabilities in hospital emergency rooms and treatment facilities as far away as Utah and Arizona.
We don't want to just bring kids home and replace them with other kids. We want to stop kids from going out of state. This is their home. This is where they should be served.
Nancy Cronin is the executive director of the Maine Developmental Disabilities Council. She and other disability rights advocates say a locked facility could put vulnerable children more at risk for potential abuse. They also want the state to prioritize rebuilding its network of community-based services.
How are we systemically moving so that children can get their needs met at whatever level of care they need? And this has to be much bigger than 16 beds.
According to a DHHS spokesperson, the PRTF will provide a level of care that is not designed for children with intellectual and developmental disabilities. Jessica Reed's son, Brody, is on the autism spectrum. He is nonverbal and has severe behavioral needs. The 13-year-old has been on a waiting list for a residential program in Maryland, but his family would much rather have a placement for him in Maine.
They're only addressing one certain part of the population when there are still hundreds of kids that are in crisis, like Brody, that have nowhere to go, not in state, not out of state, not anywhere.
Last September, Maine Health Spring Harbor Hospital closed its 12-bed behavioral health unit due to repairs and staffing issues. The only unit in the state that accepts children and youth with developmental and intellectual disabilities. Kelly Barton, the president of Maine Behavioral Health Care, tells News Center Maine that by June, the facility will have converted all of its beds to private rooms, which will expand capacity to 30 beds, including for patients with special needs.
Kids won't necessarily be placed in a specialized unit, but we will still be admitting those kids to the hospital.
The locked program could open its doors in April of 2026. In Saco, Vivian Lee, News Center, Maine.
Sweetzer could begin accepting referrals for treatment next spring. Placements for children with Maine Care will be prioritized.